The CDC warned us it wasn't a question of if, but when coronavirus would spread inside the U.S. And every day, as you know, more cases are being reported. Here in Massachusetts, we've had 2 confirmed, and just learned this afternoon that a man diagnosed with coronavirus in Tennessee recently traveled through Logan Airport. At this point, at least 18 states have confirmed cases, and California became the 3rd state to declare an emergency after 1 person with coronavirus there died. Earlier this week, Florida declared a state of emergency, as well as did Washington, where, as you know, 10 people have died. In all, at least 11 U.S. deaths have been linked to the coronavirus, and there are more than 160 confirmed cases, with many more still waiting to be tested. That's in part because the CDC had not been approving most coronavirus tests unless the patient had recently traveled to China or come in close contact with someone with a confirmed case. But those restrictions were lifted today.
Through the efforts of HHS, 2,500 kits of tests are going out this week. That's roughly 1.5 million. A test that will be available this week. We'll continue to build on that number.
Testing is key to containing the virus, which the World Health Organization says is still possible. And it's urging governments to do more, as there are now in excess of 95,000 confirmed cases around the world. And they say the death rate is higher than officials first thought, at 3.4%, meaning at least 3 out of every 100 people who get this virus is dying. I'm joined now by a former special assistant to President Trump on catastrophic events and senior director for resilience policy on the National Security Council, Mark Harvey, who also worked on the Obama administration's response to the Ebola crisis. He's now a fellow at Harvard's Kennedy School. Mark, it's great to meet you. Thanks for being here. Dr. Vanessa Kerry is director of the program in global public policy and social change at Harvard Medical School and the CEO of the nonprofit Seed Global Health. Great to see you, too. Thanks for being here. I'm not expecting Nostradamus-like precision, but where do you expect this to go in the U.S. in the next week, in the next month, in the months ahead, Mark?
So I think what we're really looking at is the numbers are starting to become irrelevant. We know that we're going to have a spread of cases, so the important point is to start looking at a community level. Right now, we've gone from national containment, and now we have to look at community by community containment and look at how this is going to spread. We probably see it ramp up over the next few weeks, and then it's a very big question on understanding how this virus presents and how it spreads with the more cases that go out there.
Are you on the same page?
I think we're going to see a marked increase in cases in the next weeks for a combination of reasons. I think, one, we know from the study that came out of Washington State that helped confirm that with the genetic mapping of the virus, this virus has probably been circulating in our country for weeks, actually, somewhat undetected. And in part, that's because many people don't get severely ill unless you're in a high-risk category. That said, I think that you're going to see market spread as people are moving. We've had, we haven't been necessarily having enough surveillance in this country to date when I think we'd had weeks to prepare. We could have been doing more on that. I think the other reason we're going to start to see many more cases is you roll out all those testing kits. We're going to start testing people, and they're going to become positive.
But the good part of that is the death rate may go down, too, right? If there are a lot of people with the virus who haven't been tested, and they are tested, and we find out they have it, that is going to bring the death rate down.
We hope. We're still learning, and I think there's every reason to believe the death rate will go down. But the real story here and the real risk is what's going to happen to the U.S. healthcare system.
Meaning
because
what?
If we have a spread of this virus around the disease or around the country, the risk is you're going to see more people who are at risk get infected, and those at-risk patients go on to develop severe disease. On top of a bad flu season and other issues, we're not going to have enough capacity to be able to address all those cases.
I was going to address this later, but I would say 50% of the emails I get on this, Mark, say, I looked it up, and according to the CDC, in 2018-2019 flu season, I'm maybe off by a few, 36,000 people died of the traditional flu in this country. Why are you all talking so much about something that has taken the life of 11 people? What should I be saying to those people?
The challenge is that it's new and it's not well understood yet. So we have to be able to characterize this disease as it starts to present here. I think Dr. Kerry is very right that there are likely to be some stresses on the healthcare system because you're looking at something above and beyond what we already see. The real point, too, is to understand where this risk is. Just looking at a baseline death rate for everybody that has it masks the actual issue is that the risk for the population here are those over 60. younger population seems to be presenting much more akin to a common cold or common flu.
And those with cardiovascular disease, diabetes, chronic respiratory disease, which
Underlying
is a lot
health
of folks
issues
in America.
You know, you're the experts, I'm not. I'll tell you what's putting me totally over the edge is that we hear reports from the president, from the experts, and on so many issues, their paths diverge. And it seems to me, as a layperson, one of the most important things in a public health crisis is timely, accurate information. Here are just a couple of examples of the president contradicting experts on vaccine timelines, safety protocols, and death rates. Here they are.
That is going to be at the earliest a year to a year and a half, no matter how fast you go.
We had a great meeting today with a lot of the great companies, and they're going to have vaccines, I think, relatively soon.
Covering your cough, staying home when you're sick, really important ways that you can prevent the spread of respiratory viruses.
We have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work, but they get better.
Globally, about 3.4% of reported COVID-19 cases have died.
Well, I think the 3.4% is really a false number. Now, this is just my hunch.
You know, Mark, I don't like starting every day at factcheck.org or factcheck.com. Is it not a problem that we're getting such conflicting messages from, I would argue, the most important people in terms of public education on this?
I think you heard some great messages from CDC and HHS right there. And like I say, now that this is presenting in multiple communities, talking to your local public health providers are really some of the best places to go, or talking to your own healthcare provider. If the job of the president is, it's March Madness season. He's not out there laying up three-pointers. President is a coach to make sure he's got the right people in the right places, putting together the right
But he's
game
not
plan.
playing coach here. Go
I
ahead.
have to counter that for a moment, though. When you are the leader of a country, you have a responsibility to build trust in your government and to protect your people and to give correct and accurate information. The trouble that I struggle with right now and what's happening and what has happened is that when we saw this surge come out of China, we knew that this was likely to hit our shores. And the
That was around
WHO,
early January, for those who
early
don't
January,
remember, yeah.
correct. And we knew it was going to hit our shores. And the WHO was saying, don't put in travel bans, focus on widespread surveillance. We could have been ramping up our health system to have test kits, to be in a better position to be able to address it as it started to hit in our communities. I agree with you. We have to be addressing this at a community level now. But we also have to be having a honest and directive to the American people to build trust. I think so much of the panic and misinformation was because it's very difficult to believe somebody when they say coronavirus is going to go away. We had lots of evidence around the world that wasn't happening.
Isn't that, would it be better in this case if the president said nothing? It is better to say nothing than to contradict the experts, is it not?
I think the best thing is listen to the experts. Absolutely. Talk to your healthcare provider, the public health professionals. Those are the people that have good guidance out here. And frankly, from the administration perspective, they've been working with the states and localities all along.
By the way, Vanessa said a minute ago, talked about preparedness. You were in the preparedness business for much of your career. We were unprepared for this, were we not? We did know, I think in the late December, early January, we were not nearly up to speed as fast as we should have been. Were we or were we?
So preparedness doesn't start right when you first detect the disease. It actually starts a lot earlier than that. Last August, I was part of an exercise that was led by the Department of Health and Human Services and worked with all departments and agencies around the government to look at a scenario almost exactly like this. We learned the lessons from that. We started applying the lessons to that as early as possible. In this, we looked at the first human cases that were there in China. We understood when those were happening, tried to get as much information out of China as possible, so that there were preparedness efforts in place.
But the testing thing, for one example, was a disaster.
Testing, at some point, you're going to exceed capacity of what was out there. So, yes, we ramped up.
We know, the second we knew, so one of the problems with the testing kits, the test kits that were issued by the U.S. government had a faulty reagent in them that made a lot of them not able to be used. But there have been effective tests out there in South Korea, in other countries, in the UK, in Singapore, that we would be able to have access to or use or could have ramped up or replicated,
but now
rather
that we
than
have
saying
more,
that had to be FDA approved.
And now that we have more tests, from my understanding, is we don't have the lab capacity to process them fast enough as well. Can I ask you, going forward, we just have about a minute left, what should we be doing? I mean, on the government, what are the most important one or two things the federal government does going forward to make this less of a painful episode for the American people?
Well, I think one is to provide honest, accurate information, to mobilize quickly, and to ensure that we have the equipment and pieces we need to allow testing widespread, to the ability that we can to support folks that are trying to care for the population, but also to protect. I'm a physician at Mass General Hospital. My colleagues are going to be on the front lines of addressing these cases, and if we don't have enough masks or protective equipment to be able to care for them, that's a problem. But this government also needs to make sure it protects those that are poor, don't have access to health care, those that aren't going to have access to leave policies that allow them to miss work or to be able to protect their families. Many people are already being laid off in this situation. That's a huge concern for the future and the legacy of this illness.
What's on your list, quickly, if you will, Mark?
So really there's two aspects to this. There's a healthcare aspect, and then there's a broader economic impact aspect to that. First, we need to continue to best characterize the risk and prioritize medical delivery to the high-risk populations, those that are immune compromised, older, and make sure that the resources that are being ramped up are being provided to them. This $8.3 billion that Congress has passed, $6.4 billion of it to go to antivirals, vaccine development, but some of that is also in small business assistance as well. That transitions us to take a look at the economic impacts. The supply chain disruptions that are happening because of this worldwide are going to be felt for quite some time now, and that's something that the government is also trying to get its hands around at this point, but really has to start working together with the private sector to best understand.
Well, the private sector has to diversify their manufacturing sites too. Dr. Mark, pleasure. Thank you so much. We're on handshake hiatus here, by the way, so I thank you both for being here.